Hi, everybody. Welcome to this webinar screencast. I'm really excited to show you what we've created in our mission to help really redefine healthcare and add medical fitness to medical systems worldwide to help get better clinical outcomes, as well as to grow practices using medical fitness as a patient attractor. So I'm going to do my best to go over some different forms. I know this looks messy and chaotic. This is my delivery system of everything that we've created and how it goes. It's much more organized, which I'll show you, which comes to the licensees when they purchase our programs, our other coaching clients, and the various services we offer. So I will start by saying if somebody's really looking at medical fitness, they often ask, well, what is our cost? What does it include and everything? So I'm going to be step by step going over if somebody was a license or a franchise in our program, what that would mean. And usually that first year cost is $10,000 one-time fee and $1,000 a month, meaning our total cost is $22,000 for that first year. We always have that promise. If you don't create that in revenue, we'd refund anything short of that, meaning it would be hard pressed, if not impossible, to not have that happen unless things went dramatically wrong. That second year, the continued coaching, you never have to pay the licensing fee again. It would just be $500 a month. First thing that our program includes is the branded web university. So to give you an idea of what that is, this is our branded university system right here. This is Rejuve University. When it's a licensing, means you would take this MedFit program and it's white labeled. You would create it to fit your practice. If your practice name is ABC Pain Management, it would be ABC University if that's what you want to call it. If you're Restore Health, it's Restore University. So Rejuve University. Rejuve is our brick and mortar business, our integrated healthcare lab that we have, regenerative orthopedics, functional medicine, and medical fitness. However, we're adding medical fitness to different OBGYN clinics or family practice or surgical settings or hospital facilities. So this medical fitness piece can plug on to any program that's out there, and that's what I'll help go over is where it is. But we do have physician education. There are meal plans, there's cookbooks. So every patient that usually comes through your practice, we offer this program, and even if they're not joining our fitness program, we want to educate our patients on how to eat better, how to optimize your hormones and your labs so you can feel full zest and vitality. So we would personalize this to every program. It has shopping tours, videos, workout videos, and then the university. This is the down plans. The video series is the university videos that are filmed by a doctor that again is not our stuff. It's just talking about general health. And if people want to rebrand that or have their people in there, we teach you how to refilm that. So that's what's included on that first form of what the Rejuve University thing is. The medical fitness system, a lot of people ask what that is. And what the medical fitness system is our MedFit Drive. A lot of you have probably seen some of these documents right here where it's what is medical fitness as published before, what are our program differences. This is that form that I'm going over right now. MedFit Rat Card is how normally we start going through things. Every clinic that we add MedFit to has a different structure. We can start in a small gym. We can start in a big facility. We can build out. Every clinic's a little bit different. This is the license information that you're reviewing that is now going to go over what it has everything. This is a PowerPoint that I've done that it kind of explains our model, how it all works, and it's all there for yours to review. But I'm going to go in what some happens when they become a licensee, which is an affiliate to us, what is included in this program. And it's a turnkey marketing systems inform, meaning if you purchase this program, you would not have to create one thing. We have thousands of content emails and programs. What you'd have to do is add your logo, your name, your signature to it. It's all rebrandable towards your business. So this is what the MedFit Mastermind is. It's a little overwhelming to people. We do have a 90-day checklist that I will go over that we definitely take people step by step as they go through this program. But we do monthly webinars, which we'll get to. But what is the thing? These are sales pages, scripts, opt-ins for ebooks. So you have giveaways where you can capture people's emails, different flyers, different direct mail piece, safety manuals. But the main thing is here's content email, or I was talking about. This is how we market. There's hundreds of emails of different content. There's 3 of them in here called the stories, tips, or stories, tips, and mindset emails. When you open those up, those have over 50 to 100 emails in them on their own. So you won't have to create any content, and email marketing is one of our most important. See, here's the mindset emails. If I were open on this, there would be 50 more pages of content that you're putting out there, from your goals to how you do. They tell stories that are good. This isn't information. This is strong marketing copy to make work. So when I go back here, that's not what I was trying to do. I got away from that. So I'm going to try not to click on too many links, as it'll take me back to step 1, but just want to go over what's included in there. Inside of this that was the content email I showed you. We have, when we roll out programs, there's numerous programs from letters to coaches, sales letter, direct mail pieces, our small term programs, our Facebook Phenom, radio ads, everything that we've done from copy, all of our marketing ads go in here as well. Hopefully it'll allow me to just go back a link or 2 at a time. I didn't remember it doing so. So back to the going backwards a little bit here. So content email, marketing, promotions. Now when we open up that master, that's where the majority of stuff is. So from our clinical operation manuals to our corporate wellness, if you open this up again, it's hard for me to go in and try to come back right here. Here's everything we've done to create corporate wellness, on the letters to the programs to the biometric screenings to corporate presentations to different challenges that we've done to different agreements that we've done to signing in for lunch and learns. Everything set to create a medical fitness program would allow you to have right at your beck and call right there. Dietitian documents, email promotion and contests. Didn't show you that. Those are just different marketing email, but these are email programs and our Facebook programs from our 20 and 42, which is our flagship program, our biggest loser programs, our bikini ready body to rock your skinny jeans for the holidays, New Year's revolution. These are all done copy that convert when done the right way. And this is where a lot of programs struggle to grow, is they don't know how to market. This concept makes sense, it'll grow, but it's marketing that is really centered around growing it. Our MedFit training manual, that's when our people come here. This is the whole operating system, from everything that goes with the sales consults to how we set our pricings to trade agreements to when we sign somebody up new, every folder that goes along with it, additional forms, our Rejuve University, the PowerPoint presentations when we're doing lunch and learns, how the websites need to be set up, every system from how do we capture before and after pictures to how do we enter agreements, how do we retain, when people cancel, how do we follow up, how do we manage our time, how do we do checklists, job descriptions, everything you could imagine is in here. How do we train the medical integration for the trainers? How do they operate differently than they did at a gym when your trainers are doing this? So your employee HR forms, all of these have numerous content behind each one of them that will allow you to be successful at what you're trying to accomplish. Now, again, it's a little overwhelming. It's not to all be implemented in one setting. It's piece by piece to go into it. So back into this master here. The MedFit training manual is the main operating system, but there's nutrition resources, other PowerPoints and lunch and learns, our different vendors for GPO options, the book owner's manual that comes with it. It explains everything, every detail in depth with the marketing, how when we hire new employees, the checklist, our HR forms, everything is in this right there that you would need to be successful. Every clinic form we've ever created, even though you're just adding medical fitness, maybe you're doing the whole concept, it's all there. So now if we go back to that one sheet, hopefully that explains what the medical fitness system is. Those are all the forms, documents, anything you'd ever need. You wouldn't have to create one thing. Now, how we help bring this along is we have 4 coaching calls per month. Myself is on the first one where we're talking strategy, next steps, hiring, projections, financials, everything, how to integrate to your clinic. Second call of the month is with our marketing team. Listen on how do we do Facebook ads, how do we do squeeze pages and lead pages, how do we do email automation. Third call of the month is with our operations director, who's Garrett, who's going to teach us how to run the operating system, how to go technical, how to get our EHR to talk with our trainer scheduling system. It's really essential for how it operates coaching there. The fourth call of the month is myself again, to where I'm just going over our 90-day checklist, the essentials of getting this thing up and running and successful right there. Anybody that comes here, we do train and require at least 3.5-day visit here to our facility, where we're able to go over step A through Z, train people how to do it, how to do the movement screenings, how to integrate, how to do the consultations. Even all the documents are there. We found not just seeing it, but training it and going through it is very important to the success of it. We do have our masterminds in California. Those are optional. In 2017, we'll no longer be offering that as part of the licensee. It's more of the value we've had until we get to 40 units to try and do everything and give away everything possible to make our affiliates successful, until we can no longer have that many people in our mastermind sessions. So the yearly business summit, that's where we have in-depth professionals that we're affiliated with that are being very successful, where we continue to enforce and train our model deeper. Our webinars, so that's a good show here. We have a monthly webinar each month that dives into the systems even deeper. So when you look at those recordings when we do them, then we have inside of there, we have the webinars of previous replays that are being on there. So here's some of the last ones that we've done. We do add new ones at all times right there. Here's just a recent of the few. We're on a whole nother system. Now we're integrating it all over here. So I'm only seeing this year's ones versus our old ones aren't on there yet. But do we have those? Absolutely, yes, we have all of those. Back to the MedFit documents. Masterminds, the webinars, you going right there. Review business systems, you've seen that in all the forms up here. That was pretty much the same things. If somebody wants to come and learn from us how we're doing our functional medicine, they're welcome to shadow, learn, and be a part of it as much as they want. They get all Doc's books. Not everybody's an orthopedic or pain management on what he's done to really advance the art of regenerative medicine. We want to help you gain those injections and procedural-based skills if that fits your model. We do have several programs that are going to save you thousands of dollars in terms of discounts on supplements, the machines, the packages, anything that we use. We've asked our vendors to give us group discounts to make it more affordable for all of our affiliates. And then we have prizes and incentives for all of our people. So that's what the program is, with everything in there, what it includes, how we do that. One of the last forms I want to show you is, after you've reviewed this, there's several much more information to give you that would help guide you. That's where I don't try to give away everything that you don't need. That's where I would know differently in terms of step 1, step 2, step 3. Here's a snapshot of that 90-day coaching checklist. That how do we schedule those calls? Here's the things that we need to go over in specific order before we move on to the next system. So we hold your implementers and your team accountable to making each one of these things step by step. There's 3, 5, 7 years worth of work here. You're not going to get as far as in year 1. We've made sure we've laid out what you got to get done before we can move on. So from this point, there will be new action steps, but not at the sacrifice of our numbers and our key performance indicators. So each month on those coachly calls, when I'm going over things, I'm looking at how many people did they sign up. This is a group that we just started that started 2 months ago. So they signed up 11 people. Our monthly new starting goal is 12 people that first month. So I help coach her how to get more leads, how to get more contacts, and how to increase the upper sales. She's only closing at 50%. We want to be at 70%. Is she doing a great job? Absolutely. But we still have our metrics, and there's consulting and accountability that I hold to each one of these people operating the program. So the coaching is really the secret sauce to being successful. Is people need accountability, certain metrics that matter to be successful. So that's kind of how it goes. Going back to that file, what we need to do is for this to make sense to you after you've reviewed everything is we're certainly going to dive into deeper of whether you need to put projections in place. I have those right there. If we're looking at different steps of cash flow projections to job descriptions for those fitness directors, or how if you don't have space internally, you can go to Snap Fitness. We have different why gyms would want to partner and different contracts that we'd give to those gyms, or how to put those ads out on Facebook, how to interview. I just want you to know everything is turnkey and done. It's just a matter of how we make it work for your program, but it's been all thought through, and we do everything to make our people successful. So hopefully that gives you an understanding of what our program includes in terms of everything on this standpoint, what the forms are, what some of the value is, and then different questions and different resources I would have to help you along to make sure this is the right decision for you. If not now, maybe in the future, because we strongly believe this is where healthcare is going, where there needs to be a preventative model focused on bringing things forward to help people really grow their clinics and change healthcare, because it's a broken system in terms of not always focusing on the root cause. So that's what the goal of our programs are, is to get better clinical outcomes and to help grow our clinic models so we can help more people. So thank you so much for staying tuned. I know it's a lot of information, but hopefully it gives you a snapshot of what our program includes. Thank you so much.